I have a new textbook coming out on FUE. It's the second edition to my book that I published in 2016. And this book is double the book, actually more than that. It's 60 chapters, 1,300 pages long. The previous book was 25 chapters and about 470 pages, so very large book. One of the topics that I covered in this textbook is SDA, or safe donor area. So the safe donor area was originally defined by Walter Unger back many eons ago, and basically what it was defined as was the area that if you took those grafts out and moved them to the front, they would preserve the genetic characteristics of the donor hair, therefore would not fall out. And that was defined as a narrow region. For example, the most advanced baldness is what's called a Norwood 7, and that's like a horseshoe in the back of the head. And so that area in the baldest man should still be there. Now, of course, there are things that just to make that even more difficult to understand is some people have a very high horseshoe, some have a low horseshoe, some people still thin out in the horseshoe and still would not be safe. However, a surgeon trying to predict the future must always think about what is the most conservative approach and how can that surgeon have enough grafts to manage future problems. So with the advent of FUE over the last 20 years, and really especially over the last 5 to 6 years, there has been a trend to overharvest the donor area. And also beyond overharvesting, there is also an expanded concept of the safe donor area, where some doctors call it the less safe donor area. By definition, FUE must harvest beyond the traditional SDA or traditional safe donor area. There is no way that you can harvest off even a very narrow little central zone of the donor area, because what'll happen, you'll have a moth-eaten central band. And so whenever I do FUE, I harvest over a much wider area to minimize the risk of not only over-harvesting, but also just to have a balanced area of harvest. So by definition, I'm going beyond the safety areas that Unger has defined many eons ago, and even refined and altered by other people after him. But does that mean that I'm practicing unsafe medicine or unsafe surgery? No, but I do counsel patients coming in for FUE that I have to look at them and whether I'm doing a safe job for them. So what are things that push me away from FUE in terms of safety? So I'm just talking specifically about the safe donor area. So if someone starts to have crown involvement, I'm always worried that the crown is going to expand. And so I'm worried that by harvesting in the donor area up high, that those grafts will be exposed and the scar will be exposed. Now, have I done FUE for crowns? Yes, I can think of a gentleman I just did last month. What are the exceptions to the rule? So yes, that I am going beyond the traditional SDA or traditional safe donor area. But one is that the crown can't be too large, and they must have a high fringe. In other words, the backside of the scalp has a very wide area where I can harvest from. And 3 is I want to stay a little bit farther away from the perimeter of the crown. And they have to have good density, and they also have to be knowledgeable that these are some of the risk factors of doing FUE into the crown area or harvesting FUE in a person where the crown is starting to expand. The safest person has really no miniaturization or no compromise in the crown area, and they have more limited frontal or even moderate loss in the front. That person is a much safer FUE candidate. And if the person is older, the better. Obviously, it gives me the best chance of doing FUE for the frontal scalp. So this is probably a very complicated discussion, and maybe it's beyond the scope of what a podcast can handle, but it tells you an inkling of some of the complicated and sophisticated thought processes that are in my head to determine, one is, are you a safe candidate for a hair transplant to begin with? And 2 is, are you a safe candidate for FUE versus a strip procedure And these are all the thought processes that enter my mind during a consultation when I see you. Hopefully it gives you an inkling of of what is important in a consultation with a physician.